Assalamu alaikum, myself Danyal Hassan from uvas, Lahore. Today I will represent the case study of the assessment of the fertility in male Devon Rex cat. We have a young male Devon Rex cat who is not producing the kitten. He is the only the male with the 5 females. The owner observed the mating but he does not observe any pregnancy. So the concern is about the breeding soundness, performance and the fertility of the male cat. The Tom was brought as a kitten and showed the interest in breeding about 1.5 years ago. The female cats have the kitten from the other males, but the male cat has no kitten from the queen side. So this is the not issue from the queen side but also the issue from the male Tom cat. The owner performed testosterone test, which is also the normal. The Tom has no health issues like FIP and FLP. The physical exam did not show any obvious disease. This was the problem in the reproductive tract in the Tom's cat. The testicle was in small size and the softer than the normal testicle. The penile spines like keratin projections that usually help to stimulate the ovulation in queens were present but not well developed. We took some measurements and noted that in diagnosing fertility issues, veterinarians do a systemic workup. First, we palpated the testicles and looked at the penis and could use the ultrasound if the internal structures are checked. We consider everything from the hormones for the analysis of the semen. We also planned the semen collection by using the chemical ejaculation. If that failed, we should use electro-ejaculation under the anesthesia. Finally, we collected the urine directly from the bladder to check for the retrograde ejaculation. That means the sperm go backward into the bladder instead of the out. We tried 2 ways to get the semen. First with sedation and the catheter, but we found the zero sperm. Then we used the electro-ejaculation. We inserted the probe into the rectum and applied the gentle electrical stimulation to trigger ejaculation. We had a clear fluid, but under the microscope the fluid had zero sperms. Then to confirm whether it was the fluid of the ejaculation, we performed the alkaline phosphatase test, but it was high, so the cat did ejaculation, but it was completely azoospermic. This slide discusses the general principle and how they contribute. Many general factors that affect the fertility. In cats, the unique pattern is that the queens only ovulate when they are stimulated by the mating. The Tom has to mate multiple times in one heat cycle for the ovulation, and the male penile spines play a vital role in that trigger. When the male is neutered, his penile spines are regressed, but in our cat, he is intact, but this shows the lower androgen level. After that, we performed the testicular biopsy, which shows that the sperms were not maturing beyond the early age, which was uncommon in cats. The decision was to neuter the cat. This removed the infertile Tom from the breeding. On cross-examination, we found that the testicles were of the small size. Under the microscope, we found the sperm cells in the primary spermatocyte stage. This confirmed the case of the sperm maturation arrest, but we don't know why this happened. Our case highlights that an apparently normal Tom can still be infertile at the cellular level. The cause was that his testes produced no mature sperms under the normal behavior and the hormone level. We learned that diagnosing the male cat fertility problems requires the multiple steps like the good history, careful examination, and semen collection and the analysis. Most important, the Tom could still make the queens think they ovulated, leading to the pseudo-pregnancy. So neutering him was the best solution to preserve the queen's breeding potential. Thank you so much for your attention.